Hi, today we're going to cover something really important for those of you who have been suffering from back or hip pain. And some of this back and hip pain can feel excruciating. And the nice thing is that it comes with an easy fix. If the cause of this pain is what I'm going to be teaching you about today, you will get relief within the day. This pain is often felt just above the belt line. It can also be felt in the hips. Trying to get comfortable is really hard. You're moving around, trying to find that comfortable position, especially if you're a side sleeper, it can be really difficult to find that comfortable place. For many women later in pregnancy, this muscle becomes a source of pain. The pain can make walking almost impossible, and you'll understand why when you understand the role of that muscle. For people who have a chronic condition in this muscle, it can sometimes pull your pelvis back and almost give you the impression of having a flat back or having your tail, your sacrum tucked under. By understanding this muscle, we will help you get to the source of the problem. Well, in order to help understand the causes, let's first learn, what does this muscle do and where is it? I'm talking about the gluteus medius muscle. This muscle is positioned underneath the gluteus maximus muscle. It's the third of the hip muscles. We have a gluteus maximus, a gluteus medius, and a gluteus minimus, a bit smaller and a little bit lower. The job of the gluteus medius is each time you take a step, it's keeping your pelvis level. So with that in mind, it's often overworked when you're carrying weight while walking, or you're constantly carrying a child on one hip, or you're constantly standing and putting that muscle on a stretch. Other things that can load the muscle are weightlifting, running, aerobic activities, sitting on a wallet, long periods of sitting, because as soon as you get up, you're asking that muscle to work, but it's been stretched for a long period of time. Another thing that can cause trigger points or pain in that muscle is having a leg length discrepancy, meaning one leg is shorter than the other. Having a fall can set up that muscle for pain, as well as sitting with your legs crossed. Another cause is when you get dressed and you're standing on one foot. You can catch your toe and then strain the supporting muscle. The leg that you're standing on is trying to keep you stable, and you're stressing it when you're getting dressed in a standing position. So how do we fix this muscle? The nice thing, it's easy to fix, and it's something you can do every day in the comfort of your home. So all we need is a ball and a wall. The first trigger point that we're going to explore, because there's several in this muscle, there's potentially several, so you always want to check. And I recommend that you do this first on your happier side. So if your right side is the painful side, please try all of these points first on your left side. Now, taking a rubber ball, and if you're really, really tender, you're going to want to take a softer ball, like one of those happy baby balls where they're a bit squishy. But otherwise, a tennis-sized ball works really well with a good grip so that you don't lose it between the wall and yourself. You're going to place the ball just to the outer seam of your pant or your skirt. And your foot that is closest to the wall is going to be placed at a 10-degree angle away from the wall. The opposite foot is placed away from your supporting foot. And for this, allows you to shift weight as much or as little as you want onto that leg. Now, in this position, you can shift your weight either side to side or up and down. Either way, it's really important that you approach the muscle with kindness. And as I say this, I want you to picture a puppy or a kitty that you once had, and if you didn't actually have them, that you wish you had. And if they were in pain, how would you start to stroke them so that they don't run away, so that they allow you to keep stroking so that you can find the source of their problem or pain? So this is really critical. On a scale of 0 to 10, we're looking for a 4 or 5. It should feel like a good discomfort. Now, you're going to explore the next part of the muscle simply by moving your foot at a 45-degree angle. So the foot that I'm standing on, I'm now going to shift it to a 45-degree angle and allow the ball to shift with me. As the ball shifts with me, it's now getting into the middle part of the gluteus medius muscle. And again, we're just going side to side. You'll notice that my strokes are very short. And I'm going to emphasize the stroking in one direction. So although I'm not moving the ball, I'm going to go pressure on, pressure off, pressure on, and pressure off. So it's short strokes, and you're looking for the most exquisite point in that stroke, and that's where you want to focus. You might be noticing that you have no points that are tender there, and then it's time to move on. So then we're going to move to the third part of the muscle where trigger points are often found. And that third part is near the sacrum. So it's really important. And so I want you to pay attention. My foot is now turning not straight ahead, but almost straight ahead. It's more like about a 10-degree angle, or now an 80-degree angle from the wall. And this angle is going to allow me to be right on the edge of the sacrum, but not on the sacrum itself. And again, I'm going to go up and down. And I'm going to limit the number of strokes. With each of the points that we have done, we limit it between 6 and 12 strokes. Far better than you do frequent strokes and you come back to them throughout the day than trying to, get rid of everything in 3 minutes. That's going to be too aggressive and too fast. If you're too aggressive, you're actually going to irritate the muscle and cause potentially more pain. With all the self-massage, breathe throughout. Make sure that your breath isn't being held. That's your body's only way of telling you it's too much pressure. Be patient with your body and be patient with the releasing of the trigger point. And then as they start to diminish more and more, be sure to come back to them at least once a week, because you might still have little bits of trigger points or tender spots that are just going to be hanging around if you don't totally get rid of them. And then once they're gone, come back and check once a month. So the guidelines you're going to see here is you're going to massage that muscle gently and slowly, like you are being very kind to it, like you're massaging a gentle puppy. The other thing you're going to do is you're going to massage it in a short stroke. You're going to massage it at least once a day. If you have twice a day to devote to it, and even 3 or 4 times a day, even better. The more you work it in short periods of time, the faster that pain will go away. Always do a comparison between the two sides to know how intense you can massage. Always use your healthy side as your guide. The next thing is to make sure that you limit the stroking to 10, 12 strokes. Don't work it too much at one time. If your pain is coming from the gluteus medius muscle, be persistent. Get rid of the common causes that are causing the pain to reoccur. And in no time, you will be able to be pain-free and active and ready to start strengthening. When you're ready to start strengthening, we've created a great playlist for you that targets the gluteus medius muscle as well as the gluteus maximus muscle in all ways that you can keep your hips strong and pain-free for years to come.